everyone. I am Camille Miller of the Natural Life Business Partnership, and we are here today on October 9th, 2018, doing our member spotlight with Jenna Richardson and Dr. Vincent Leonti of Princeton, New Jersey. And our topic today is, what is integrative healthcare? Thank you for joining us today.
Thanks, Camille.
Thank you.
They are in Princeton, New Jersey. We'll give their information at the end. So this is our video podcast that we do our member spotlights. So some of you will be listening to it on our podcast in just audio, and others will be listening to this on our NLBP-TV channel on YouTube. So I'm just letting everyone know that not everyone can see you. So if you're holding something up, we just have to explain it. Okay. So tell me a little bit about yourselves and your practice, which I find really interesting how you came together to create this practice. It's a really interesting story, and I love the journey. So I kind of wanted to start with that, and then we can talk a little bit more about what is integrative healthcare. Do you want to tell us a little bit about your story?
Sure. So I'll start. So I spent my entire life with kind of a series of health challenges, which weren't debilitating by any means, but were certainly slight struggles for me. So I grew up with allergies, acne, asthma, chronic sinus infections, a minor autoimmune condition, a bunch of things that really, again, didn't totally hinder my life and that I thought were somewhat normal. I also grew up in the 80s and 90s, so my life focused on Diet Coke and Snackwell cookies. That was my diet. Played sports, so I was relatively active. And again, just kind of went about normal life. Our family is Italian, so we were eating, consistently eating bread, pasta, pizza, kind of the staples of our diet. And it wasn't until I was into my mid-30s where I started to really think about the fact that what I was putting into my body could have a profound effect on my health. So cleared up my health challenges. And really the impetus for me kind of heading down this path to more of an alternative health model was when my son was born and we had some challenges with him. He was breastfed, but when I was working in corporate America at the time in international business and doing a lot of traveling. So when he was about 6 months old, went to introduce baby formula, and he developed a condition that was diagnosed as something called torticollis, which tends to be a congenital condition, but where his head would tilt to the side. And saw a series of conventional doctors who looked at me like I had a bunch of heads. First time mom, over paranoid. When I told them I thought it was related to digestion. And finally, the last straw for me was when a conventional MD, a gastroenterologist, attempted to prescribe him 2 medications, one which caused him to stop eating or even breastfeeding over the course of a weekend. And then the second of which, when I went to pick up at the pharmacy, the pharmacist called me aside and said, how old is your son? And I said, he's around 6 months old. And he said, well, you know that this medication is severely contraindicated for kids under the age of 2. He could stop breathing and die. So that was the beginning of my real journey, was around, figuring out now what was in baby formula that was causing this reaction, and what was in baby food, and then what was in our food. And that just evolved to me going back to school to study at the Institute for Integrative Nutrition, and then on to study functional diagnostic nutrition, which looks at the biology and physiology of food and environment and stress and our hormones and all of the effects that all of these things have on our life. And I jokingly say that I dragged my dad, Dr. Vinny, kicking and screaming over to the light side from the conventional medical world, and I'll let him tell his part of the story.
Yes, so, I've been a conventional doctor for 33 years and now in functional medicine for a couple of years. But my journey probably started actually when I was like 13 years old. My dad had a heart attack that year. And it was that year, I think, that I wrote in my, my elementary school graduation yearbook, I wanted to be a doctor. I think then I conceived it more as a healer, fast forward, I got into medical school, went through medical school, started my career. I was doing emergency medicine for 24 years and then family medicine. And, then I started to have my own health challenges. I told you my dad had a heart attack. I was out running one morning and developed chest pains, and had failed my stress test and had a cardiac cath, and I had 80% blockage in one coronary artery and 70% blockage in the other. And that was, despite being a doctor and eating what the recommended diet was at the time, which of course was, as Jenna mentioned, low fat, high carb diets. But I always kind of wondered about, what my risk factors really were, because my cholesterol was pretty average. My dad had, as I mentioned, a heart attack, but he was 60 pounds overweight and smoked Lucky Strikes, neither of which factors I had. So I kind of wondered where this came from. So then Jenna started studying integrative nutrition and telling me that, you could actually treat, diseases with nutrition and lifestyle. And an Institute of Functional Medicine course was coming up, so I decided to take it, having no idea what I was getting myself into. And went to take that course, and when I saw the power of the functional medicine, how you could actually treat disease, again, with lifestyle and nutrition, and, supplementation when needed. And, and when I saw the enthusiasm of the doctors in that room, everybody was excited to be doing medicine. Mm-hmm. I hadn't seen that in many, many years when I went to conventional medicine conferences. Usually people there are kind of beat down by the system, and, they're just kind of putting in their time and getting the CMEs they need to kind of check their boxes. But here, in functional medicine, just they said everybody is excited to be providing medical care and, and even actually healing people. And that's kind of where I started. And I was happy to finally be able to come back around to that. So, yeah, through Jenna's impetus, showing me the light side, it's a path I'm glad I'm going down now.
So functional medicine, it sounds like, is really based on the nutritional factors of giving the body what it needs. Is that correct?
Really, the premise of it is empowering all of your systems, even down to the cellular level, to create an environment of optimal health. So it's driving at the root cause of disease and dysfunction rather than just treating the symptoms. So obviously, because our cells utilize food to produce that energy, nutrition is a big component of that.
And is there a difference between functional medicine and integrative medicine, or are they relatively the same?
So, when we say integrative medicine, what we are talking about is that we are operating at kind of the connection of functional medicine and conventional medicine. We're operating, we're using all the best testing of 21st century medicine and marrying that to the wisdom that's come from, centuries of, traditional Chinese medicine, Ayurvedic medicine, the old traditions of Greek medicine. So integrative medicine kind of operates at that junction. Where I can operate in both worlds, do the testing, that's done conventionally, but also do much more specialized testing that comes along with functional medicine, and use the modalities of both conventional and functional medicine to integrate those, thus the term integrative medicine, for each unique individual, kind of a personalized medicine, if you will.
So do you still prescribe medications, or is your first course of action a diet?
Diet is a big part of it.
Yeah, I would say it depends on, who's in front of me. I would say for, greater than 90% of people, it's, diet and lifestyle. But if I have an out-of-control diabetic, we're gonna work with him on his diet and lifestyle, right. But that person may need some conventional medicine to kind of, buy us some time while these other modalities are taking effect, because nothing is overnight.
Yeah.
It's doing the work, and it takes a little bit of time.
Ultimately, we know to get people off meds.
Right.
Empower their body to leverage its innate intelligence to be well, as opposed to rely on medications.
Perfect. So when a patient starts with you for the first time, do they see both of you? Do you talk about both sides of it? Jenna, do you take like the diet, and then Dr. Vinny, do you take the medical side of it? How does it work in your practice?
So our initial intake is usually with Dr. Vinny. We have a very extensive, thorough, comprehensive intake form, which our patients complete, which provides us great insight into their current health status as well as their health history. Everything from, were they a vaginal birth or a C-section, were they breastfed or bottle fed, and then kind of everything in between. So that provides a very firm foundation for us to work from in that initial kind of clinical evaluation. And from there, we work with our patients to co-create health. So we leverage various resources internally to partner with them to work on things like lifestyle and nutrition and stress management and mindset, and kind of all of the facets that go into creating true health. So our foundational belief is that health is not the absence of disease, but kind of this foundational cohesion of various aspects in your life that come together to form health, happiness, a general sense of well-being.
So I'm curious, you had mentioned the type of birth a person has. Is that a big factor? And then the second question, which might be answered in the same one, would be, does that also imply then what the mother was eating while carrying that child had a lot to do with what's happening today, 10, 12, 20 years later?
So, yes, the type of birth. So if somebody is a cesarean section versus a vaginal birth, the baby that comes through the vaginal canal picks up the mother's microbiome there.
Right. Mm-hmm.
And when you have a cesarean section, you don't have that. So you have a very different microbiome. And that seems to be associated with allergic diseases, problems with the microbiome later on. So that's why we want to know that. That will give us often a clue as to what's going on. And nutrition plays a big role when, people are pregnant. There have been studies that actually not only does it sometimes affect the child that you're carrying, but by the effects on that child, it actually even goes down a generation further than that by their children. So what a mom does what happens with the mom when she's pregnant sometimes affects her grandchildren even. So we try to obviously encourage women to have the best nutrition. But sometimes circumstances are out of their control. I mean, some of these studies on women, those transgenerational effects were during like the Second World War, where people were starving and that kind of thing, and they could see how that affected, as I said, even the grandchildren of those women.
Excellent. We have a question that just came in from one of our members. So if you're a member of NLBP, you're allowed to join us live and ask questions. It says, what if someone didn't know what type of birth they had? Can that be determined or speculated today? Or is it even worth speculating on?
No, it's really hard to speculate on that. We just take the best information we have at the time.
Mm-hmm.
Since we are doing testing on everybody's microbiome anyway.
Okay.
We'll have an idea, but there's no, at least there hasn't been anything that I'm aware of that says the microbiome of somebody with a cesarean section looks like this, and the microbiome of somebody who was a vaginal birth looks like this. There are so many environmental influences from, that come in between usually the time that you know, they're born up until the time we see them, that usually gets obscured to a certain extent.
So a little bit of talk on the microbiome. I had read that the microbiome here in the United States is way different than we'd find, or very lacking in the bacteria, the beneficial bacteria, and a lot of other things that we'd find in other countries. Is that true? And are we able to fix that?
So yeah, so you know, because of you know, it's sad, as we like to say, the standard American diet. You know, there is not as much phytonutrient biodiversity.
Mm-hmm.
So that leads to less biodiversity in our microbiome. And yeah, can you fix that? Absolutely. And, you know, by increasing your phytonutrient biodiversity, eating the colors of the rainbow. You know, each one of those colors is a different phytonutrient profile. So the more diverse your diet can be, the more you'll increase your microbiome biodiversity.
And my background is organic agriculture, so I'd like to say that it's a big difference if it's organic or not, right? How the plant uptakes food, and then your body also fighting over those pesticides and herbicides that are killing some of our microbiomes today.
Yes. And our thought process in functional medicine, really one of our foundational beliefs is that the gut really determines everything. So you have trillions of bacteria who live in your gut, over thousands of species of which, and they really influence and control a lot of what goes on in your body, including metabolic function. So having a very strong biodiversified microbiome is super important to your health, to your immune system, to optimal function.
How do you test a microbiome? Is it simple? Is it not simple? You said you tested everybody's microbiome that comes into your practice?
Yeah, it's a PCR DNA stool test. So we send a majority, 99%. I don't know if there's even a 1% that we don't run the test on, but I'll say that just because there's no absolutes. We run this test on them. It's called the GI map. It's by a lab called Diagnostic Solutions, and it's looking for, you know, pathogens in the gut as well as inflammatory markers. So we're testing for things like, you know, viruses and bacteria and parasites and worms, and looking at gut inflammation and looking at leaky gut, which is a term we hear a lot, which we also call metabolic endotoxemia. Mm-hmm. And so it's a really good snapshot into the current microbiome picture for an individual. And oftentimes that's where we begin in terms of healing.
So have your patients, well, I assume they see huge differences, but have there been any patients that have taken huge leaps in their microbiome and have felt so much differently based on diet? Like maybe they tested really, really poorly in the beginning and then they changed something and now they have, you know, a more diverse microbiome and it's really changed some of their symptoms in the end. And how long does it take to change that? Because that's a big ecosystem going on there.
I would say a majority of our patients have those results. Who reversed, I'll say reversed, Hashimoto's thyroiditis.
Wow.
By eating and healing her gut. Her antibodies against her thyroid are gone.
Wow.
So there's such a tight link between the gut and the immune system. About 80% of our immune system is immediately adjacent to our gastrointestinal lining. So once that lining becomes compromised, which can be done in many ways, stress, toxins, food sensitivities, intolerances, eating things like gluten and dairy in some cases, your immune system becomes immediately compromised. And that's when things kind of get crazy.
And it usually takes about 3 to 6 months.
Oh,
to
that's
do
not
that.
bad.
Sometimes a little bit longer, sometimes 8 or 9, but usually we see results within about 6.
Wow, that's terrific. I was thinking it would take years, but I guess you just keep improving.
Right.
Yeah.
So some people might be longer, but usually we see at least significant shifts within about 6 months.
Wow. I have another question that just came in through our chat. It says, how about MS? And I suppose that means in the microbiome.
Yeah, so MS, multiple sclerosis, boy, I'm having trouble saying that word, sclerosis, multiple sclerosis, autoimmune disease, with functional medicine, the autoimmune diseases are, we consider that a problem with the immune system, and underlying almost every single one autoimmune disease that I can think of is a problem with the microbiome, with leaky gut. So the approach to that is similar, working on cleaning up the diet, working on, healing the gut, removing any pathogens. There are, certain bacteria that research studies have shown are actually associated with autoimmune diseases. So as part of that stool test, those bacteria tested for. Our approach to MS is essentially that, cleaning up the diet, looking to the GI tract to see what's going on there, and cleaning, helping heal that. And people have shown improvements with that.
I'm assuming that your patients must feel very surprised, right? Even though, even I read it, but going through it and just seeing something that maybe their conventional medicine and methods that they've gone through for maybe a decade before, and then coming to you and cleaning up their diet and seeing vast improvement must be quite surprising for them in a good way.
It's amazing.
Yeah. Any good stories or something you want to share with us? Maybe something a patient went through that really surprised you, or something in the beginning. I know I'm just kind of throwing it out there because I love when we can talk about a story or something that brought it through.
I'm nothing coming to.
About that, Denise.
Oh yeah, go ahead.
So one of our patients, she came to us, and she's a nurse, and she was always very active, had been, climbing mountains, hiking to the tops of mountains. But then she became extremely fatigued, would do her shift at work and would just come home and have to lay down, and she didn't have energy. It was, she had to give up her mountain hiking, so then, she went through the conventional route, and there really weren't any answers. And then she came to see us, and we did the testing. We did her GI testing, her microbiome. We helped eliminate some things there. We also tested her hormones, and it turned out that she complained of severe premenstrual problems. She would be fatigued, crampy. She would just be totally wiped out.
Mm-hmm.
Sometimes even have to take time off from work because of it. We found her hormones were out of balance. Her estrogen was too high. She was very estrogen dominant. Using some supplementation. There are actually supplements based on the chemicals from broccoli. Called sulforaphanes that lower estrogen, help you metabolize it better. And I gave it to her, And I remember she called and left a message at the office, and I called her back, and she was just ecstatic. She said she couldn't believe she just had gone through a period, and for the first time in years, it didn't wipe her out. She felt so much better. And then she just started to improve from there after we improved her microbiome and her hormones. And she actually was able, after about 6-7 months, she started hiking and was up in Vermont and hiked up one of the 4,000-foot mountains and, literally feeling like she was on top of the world again.
That's a terrific story. That's a great story. Now, do you recommend probiotics at all, or just really changing someone's diet? 'Cause I guess even baby steps, anything helps.
Both. We definitely believe, given your question earlier and the response around the standard American diet is, unfortunately, as you probably well know, even eating as healthy diet as possible, just the way our farming practices have evolved, it's very difficult to get the amount of nutrition that you actually need to live optimally. So, we do advocate for supplementation in certain cases, but probiotics is one of them. Trying to induce the diversity of the gut microbiome. But again, we believe in a foundation concept called bioindividuality, which is that each and every person is a unique biochemical machine. So there's no one right answer. So I'll often get the question, well, what probiotic do you recommend? And the answer is, it depends. It depends on who you are and what your gut microbiome looks like. And in some cases, someone can be taking a very diverse, high quality probiotic, but perhaps it's affecting them negatively because they may be dealing with something like small intestinal bacterial overgrowth, or SIBO. So they're feeding bacteria in their small intestines where bacteria are not supposed to be, and that's causing challenges for them. So really, you need to have a full picture of that person and what's going on with them, and have that testing and have that health history and be able to determine kind of the clinical correlation. And a lot of times it's an extremely analytical process. It's almost a detective process in some cases, and you're peeling back the onion to figure out what's going on with that person and then how to best address that.
That's fabulous information there, because I think people run out and they try everything, the probiotics, the prebiotics, the kombucha, I'll just try all of this. But what you're saying is that testing that you do kind of starts that mapping process of what each individual person needs, and not every family member needs exactly the same thing as we move forward. Yeah. Good. That's good information right there. So we have another question. If it wasn't discussed, is there a typical treatment plan or length of time that you guys work with your clients, or do you do maintenance or preventative visits? Like, is it different than like a sick care plan that they go to you all the time and they kind of stay on track? Is it a different way of practicing?
Of our practice, it's built upon programs. So we have, as I mentioned, we're working with our patients not to treat symptoms and not to treat disease, but ultimately to co-create health and to co-create optimal health. So that can't be accomplished by seeing them once a year.
Okay.
So oftentimes what we'll do is work with them in a program. So our most successful program to date is one that we call Empowered Health, and it's a 6 to 8 month time frame where the patients work not only with the doctor but with myself as a functional diagnostic nutrition practitioner, integrative health coaches, and various other practitioners that we have in the practice to work on their specific set of challenges and to accomplish whatever their ultimate goals are. So like I said, it's a 6 to 8 month time frame, and more often than not, we see significant progress during that time. Now, I'm not going to say that we reverse disease or they reverse disease in every single case, but there are dramatic improvements in their health.
Excellent. And I'm assuming, like, if the parents come and the kids come, like, you get one member of the family and they see the improvement. Well, they probably all change their diet around it, because that's usually what happens.
Well, that and that's what
Just
it's about.
together.
So it's not just the patient, but it's the family and it's their friends and it's the community, and that's what we call the ripple effect. So that's what, you know, we're about creating that. And so I often talk about our 4 E's, which are engage, educate, empower, and encourage. And it's about creating that environment and that community of support for them to take that forward, because we're trying to help as many people as we possibly can.
I love that. We have another question. It says, do you do any work with clients from a distance, or does everyone come to your office? Do you do any distance healing?
We do. So we have to be a little bit careful because of, you know, he is an MD, so licensing is challenging. So he's licensed in New Jersey, Pennsylvania, and New York currently. So, you know, we're kind of covering that tri-state area. A lot of people do choose to come in because there is a lot to be gained in that personal, you know, interpersonal interaction that occurs kind of being in close proximity to one another. But, you know, we do have practitioners in our practice who are not necessarily restricted based upon licensure. So we have a health coaching based program, which we call Essential Health, which is just a program that you're working with a health coach on things like lifestyle and nutrition and behavior and mindset and stress management. And that can be done from anywhere. So, you know, we can see people who are based in California or Oregon or the UK or Europe or anywhere for the most part. We do, you know, in-person sessions, as I mentioned, but then oftentimes if patients are coming from an hour, 2 hours, or even 3 hours away, we can supplement that with things like Zoom meetings and FaceTime and, you know, all the luxuries that technology nowadays provides us.
Yeah, Zoom has really changed the world. That's what I think, right? We get to do these interviews.
Yeah,
I love it. Without setting, I used to set up cameras and stuff like that. Now we just turn on our computers, we send you a link. It's awesome. But you feel closer with people too, right?
Yeah.
So before you couldn't have that type of practice that just touched everybody.
Yes.
And it's nice to be able to do that. All right. Well, I thank you so much for joining us today. I don't know if you want to say any last words or anything that we didn't touch on that you think is really important for us to know. We're good.
The other thing that our practice is different than other practices is that we are very much into community education, just kind of amplifying what Jenna said. You know, we want to have this ripple effect. We want people to be aware that there is, you know, another way, that there is actually help for them out there. And we're just trying to get out there and spread the word. And one of the ways we do that is by, you know, doing community workshops and educational events and that kind of thing. So, you know, we try to get out there and help people in that fashion also.
Perfect. Well, I want to thank you for joining us today on our Member Spotlight. And why don't you give your contact information so we have it right at the end here. How can people get in touch with you if they want to do a follow-up or have a question or want to see you themselves?
Yeah, so our practice is Princeton Integrative Health. We are just south of Princeton in a town called Lawrenceville, New Jersey. It's LAWRENCEVILLE. Our office number is area code 609-512-1468. And we have a general email address that's info@princetonIH.com. Our website is princetonIH.com.
Excellent. Well, thank you so much for all of your time today and being a part of our NLBP-TV Member Spotlight.
Thank you.
Thank you.